Hello, I'm Dr. Elisabeth Coyne and I'm here with Dr. Jayne Hewitt. And she's just going to explain a bit about her research.
Thanks, Elisabeth. I'm actually fortunate enough to be an interdisciplinary scholar. So I'm a nurse and I have qualifications in law. So my research then tackles the challenges associated with integrating law and healthcare practice. And the aim is to achieve those optimal outcomes for patients at the end of life.
Yeah, and there's been some new rules of late, hasn't there, Jayne, that you were really involved in developing some of the the guidelines around voluntary assisted dying.
Absolutely. So voluntary assisted dying is relatively new in Queensland. It's only been around for a little while, and I was very fortunate to actually be involved with the Queensland Law Reform Commission in developing that law. And I guess ours is unique in that it actually includes a role for nurses, which is wonderful.
Yeah, and so do you want to just explain a bit about your research then, Jayne, and how you've gone through from that general understanding to now really trying to really inform the way we deal with patients and families at end of life?
Yeah, thanks, Elisabeth. So I guess the way that I came to my research was using my background as a critical care nurse. And we know that in that space, many patients don't survive. They die in intensive care. But I was a bit perplexed about some of the decision making that occurred in that space. So I was lucky enough to undertake some research around this to better understand how the law applied and how healthcare practitioners interacted with the law.
Yeah, and so one of the things that I can see that you've done there, you started with the literature review. And how does that for other researchers, how might that inform their practice as an advanced practitioner?
I think having an understanding of the research really helps you to get a sense of what others know, and it also highlights where there might be particular gaps where either further research or more education is required.
Yeah, and so can you tell us how you went across the different studies, and what really led you to stay in the path of end of life?
Yeah, well, we started, I guess, with this stream of research thinking about how those end-of-life decisions are made by first of all doing a scoping review that identified how healthcare practitioners interacted or otherwise with the law in this space internationally. We realised there was a bit of a gap in that space, and then we narrowed down a little bit to better understand what was happening in Queensland, and we did that by doing a retrospective chart audit. And that, I guess, confirmed some of the findings of the scoping review. The next step that we took was to, in fact, survey clinicians about their understanding of the law, and then ask them to participate in an interview where they spoke to us about the factors that influenced their decision making in that space.
Yeah, and did you have any surprises as you're going through that research that you thought, oh, I hadn't really realised, that came across in that research?
Yeah, we absolutely did. One of the things that we know is that the law seeks to provide patients or their substitute decision makers with authority to make decisions at the end of life. One of the things that became really evident though is that those decisions are really complex and very emotive, and so the burden of making those decisions for some family members was really tough.
Yeah, yeah. And I think that's an important thing to think of as a nurse, as you stand in that position with families, that, there's a lot more to it than what you are just seeing in that snapshot in hospital. And Jayne, I know you've got a scenario to go through. Do you want to talk us through that?
Yeah, sure. So the legal framework in Queensland actually sets out who's authorised to make decisions for a person who is at the end of life if they don't have decision-making capacity. And we asked clinicians about their understanding or which might be the correct substitute decision maker based on this scenario here. And I guess it's probably not that uncommon. Somebody presents to the emergency department, they're unconscious because they've had an accident, and there's a range of people who might be involved in that person's life who could be potential substitute decision makers. So the patient's husband, even though they've been separated, the patient's children, and the patient's same-sex partner of 5 years. So there are a range of people that could potentially, I guess, be the substitute decision maker. And while the law sets out that in this case it was in fact the same-sex partner of 5 years, there were many clinicians that, first of all, were not able to select the correct substitute decision maker. But the other thing that we found out was that even though that's exactly what the law requires, the views of all of those other people that might be important to that patient are certainly taken into account.
Yeah. And whose role is it to sort of bring those ideas to the family in that stressful time?
Yeah, that's a great question. Thanks, Elisabeth. So I think as nurses, we might assume that the doctors will know who the correct substitute decision maker is. But I guess the other thing is, as nurses, we often have a really good sense of how the family might interact and who those significant people are. So it's always a really good idea to clarify, I guess, with the doctor about who is involved in that person's life and who the appropriate substitute decision maker should be.
Because often as a nurse, they've already developed that rapport with the patient, haven't they? And so they can actually start to even make the sort of the idea with the family and discuss that. Is that the part of the nurse's role?
Certainly, sometimes nurses might plant the seed or start to explore what they understand the patient might want in these circumstances and get a bit of a sense of, for example, what the patient's values are and what might be a satisfactory outcome for them.
Yeah, and I think it's really important as you develop your role as an advanced practitioner that you remember that, you know, difficult decisions often start with the nurse and bringing sort of ideas, putting out the information. So it's really important as registered nurses that you understand your role, the rules, and who's involved.
Yeah. I think the other thing that it's important for nurses to be mindful of is that although they don't have decision-making authority in this space, frequently they're the ones that are required to action or operationalise the decision.
Yeah.
And you don't want to be responsible for operationalising a decision that's been made by the incorrect person.
Yeah, and so it's really important to think about this. You know, these are changes in our legislation, and I think it's important that as nurses that you sort of understand, you know, your scope of practice, particularly if you're working in an area where, as an advanced practitioner, you may come across scenarios where these decisions will be part of your everyday practice.
Absolutely. And as somebody who might be working in a fairly senior role, of course, more junior or less experienced nurses will be looking to you to model the correct behaviour.
Yeah. And so where's your research heading you now, Jayne?
Yeah, thanks. So we've found that there is a bit of a gap in people's knowledge. We're also mindful that probably the last thing healthcare professionals need is just more education. And what we're hoping to do is to develop some simulation scenarios that will help healthcare professionals, particularly those ones working in ED, to understand the complexities of making these decisions or working with families to make these decisions, and at the same time ensuring that the process they follow is consistent with the law.
Yeah, excellent. Thank you so much, Jayne, for sharing your work, and hopefully as advanced practitioners you can understand this area a little bit more and maybe sort of look at the depth of it in your own practice. Thank you.
Thanks, Elisabeth.